Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's today's lecture is on the subject of Kaumarbhrityatantra, that is a Balrog, that is Ayurvedic pediatrics. So this lecture is very useful for the BAMS students who are having this particular Kaumarbhrityatantra or Balaroga subject in the third year BMS. Okay. My dear friends, just for your kind notice that my student has examination, for example, just coming after 8 or 10 days. And in the syllabus for this terminal examination, we have the topics, for example, there are the topics like this. Part A, we have the importance of Kaumarbhrityatantra. Importance. This topic is already covered by Deshpande and it is available on the YouTube, my channel Ayurveda Academy, where you can check. Please note down the playlist. That is Balarog classes or Kaumarbhrityatantra classes. This is the name of the playlist. And you have to check each and every video from that particular list. There you will get the Kaumarbhritya importance. Next, there is a Vayobhed. That topic is also already recorded, discussed, and video is available. Then Kashyapa Samhita, the important topics from the Kashyapa Samhita, that also we have discussed and the video is ready. Prana Pratyagamana, neonatal resuscitation. That topic is also covered, discussed, and video is already uploaded. Now, Prashan and Lehana, this is also the topic for terminal examination, and this topic that we are today discussing. This is the part A. Now, regarding the part B, please listen carefully. There is a list of nearly 10 diseases for the terminal examination. About Kaumarbhrityatantra. Infectious diseases are there. Now, you will say, sir, in our playlist, these diseases are not there because you have not taught. No, my dear friends, I have the different playlist. Please kindly note. There is a playlist called as medicine or Ayurvedic and allopathic treatment. Can you kindly write down Ayurvedic and allopathic treatment for different diseases? Ayurvedic and allopathic treatment for different diseases. Big name for the playlist. And in that playlist, definitely, you will get some important diseases. I request you, please write down those names which you will get in that. And second playlist, another playlist I would like to tell you, please write down that name. Kaya Chikitsa. Kaya Chikitsa. Try to understand actually the disease causes, disease pathology, disease symptoms, disease signs, disease investigations, disease treatment. Everything is same in the adult and in the children. How it is possible? Yes, there is only difference in the doses. Try to understand. I want to give the anti-tubercular treatment, anti-cox treatment, AKT, for the adult. Rifampicin, isoniazid, pyrazinamide, all these medicines will also be applicable to the children, but in a very, very different doses, in a very small form. So when you want to get the idea about the diseases, I request you to check my playlist. Write down Kaya Chikitsa, very important subject. K-A-Y-A, Kaya Chikitsa. In that playlist, you will find some diseases. For example, Ayurvedic and allopathic treatment or also Kaya Chikitsa, you can find pneumonia. It is already there. Yes, pneumonia. Then you can find mumps. There is already discussion is there. Mumps, Galgunda, parotitis, mumps. Muscular dystrophy. Yes, already video is uploaded. You have to just only see. Dr. Deshpande is energetically telling, very simple, muscular dystrophy. Then measles, that is also there in Kaya Chikitsa subject. Then chicken pox, already video is there. Then ADHD, write down AD, video is there in my channel, ADHD. Third playlist is Ayurvedic treatment for different diseases. There you will get this video. That is attention deficit hyperactive disorder. जो चंचल होते हैं ना लड़के, बहुत गड़बड़ी करते हैं, उनको बोलते हैं अटेंशन डेफिसिट hyperactive children are there. But video is available. Don't tell me, sir, video is not there. Video is there. But only few diseases that I am also revising if I complete this Prashan and Lehana topic little bit earlier. I will also try to discuss some of the infectious diseases in this 1 hour. Okay, let us start. I am sorry, I think this topic is not of Sastha I am sorry. There is a printing mistake. This topic is from the Bal Roga. I am extremely sorry. Printing mistake is there. Please excuse me. So, Prashana and Lehana. These are the two words. Prashana, Lehana. As usual, you have to write down the keywords. I will tell you very important words. First, I will like to mark this particular topic so you can focus. So, actually, there is no difference. Prashana and Lehana, same. Please write down. Prashana, Lehana, many times used as the alternative word. Sometimes Prashan is called as Lehana, Lehan is called as Prashan. Here you can see synonyms. Many times it is used alternatively. But little difference. Prashana is like eating. Eating. Prashana. But Lehana, licking. Honey. Honey is not Prashan. Honey is a Lehana. शहद मधु बोलते हैं ना, मधु संस्कृत में, that is a Lehana. चाटण बोलते, चाटण देतात, मराठीमध्ये आम्ही चाटण देणं म्हणतो. बरीचशी औषध, many medicines are given with ghee and honey. So that honey is like a Lehana, consuming by licking on the tongue. I am making action so that you can remember. That is Lehana. The substances which are consumed by Lehana are called as, or is called as a Leya substance. Leya. Leya. Okay. These substances are anchas. Very, very, what you can, snigdha in Sanskrit shabda, snigdha. Little bit fatty, little bit oily, little bit anchas. Then also sticky, little bit sticky. Of course, you can always remember the honey is a Lehana. Honey is a Lehana. शहद लेहन है, ठीक है? और सेमी सॉलिड होता है, लिक्विड भी नहीं और बिल्कुल सॉलिड जैसा भी नहीं होता. Hence, any food substances or any medicines which is having unctuous, which is little bit sticky, which is little bit semi-solid, can be used as Lehana or Prashana. So you can understand what I mean to say. In children, especially in the infant, remember, below the age of 1 year, very, very small children, they always, our medicine should be in the form of Lehana. They cannot bite the tablets. They cannot engulf the capsule. Bitter taste is not good for them. So for the baby, for the children, for the infant, Lehana is the best medicine. And when the medicine, in the sense, when patient can take, that is called as a compliance of the medicine. Feedback, compliance, respond to the medicines will be good if the patient can happy while taking the medicines. Are you understanding? So Lehana medicine, this type of the medicine is very good for the children. This is one of the most convenient, very easy and safe way of administrating the food and the medicine. Next, in Kashyap Samhita, because Kashyap Samhita is basically Ayurvedic pediatrics textbook. Kashyap Samhita, Ayurvedic textbook of Ayurvedic pediatrics, a textbook of Ayurvedic pediatrics. There is whole chapter is called as a Leha Adhyaya chapter. Lehan regarding description of all these pharmaceutical procedures, examples, how to take it, what is the dose, this and that. All the information in Leh Adhyaya. This is dedicated for the concept of Lehana. Specific details about the indications, when to give, to whom we should give, and contraindications. No, this should not be given to that particular child. Have been mentioned, as well as the various dravyas, various formulations which can be used as a lehana, along with their action, is explained in Kashyap Samhita in Leh Adhyaya. Okay. Lehana is a best to make a general growth and development of the child. Very, very nutritious. Is like a food supplement. Remember this. It is also promotes, like modern doctors, they prescribe the protein supplements. They can give the vitamin supplement. Similarly, Ayurvedic Vaidya are always giving some Lehana type of the product. Promotes the Ayu, whole quality of the life, Medha. Medha, what is Medha? Grasping capacity. And Bala, physical and mental strength will be increased. Now, here are some indications and contraindications. For example, these are the parameters and what are the indications and what are the contraindications related to the breast milk. For the first 6th month after the birth, what is the best food for the baby? WHO, World Health Organization, is saying breast milk is the #1 food for the first 6th month of life of the baby. There, when that baby is having breast milk, if there is no breast milk, enough breast milk, asrav, then nutritional lehana should be given to the baby. Then dushtasthanya, it is infected, breast milk cannot be given, then lehana can be given, the different medicines can be given. Then difficult, so okay, this is asrava, then kshaya means deficiency, and dushtasthanya, then we have to give the lehana as a supplement. But we cannot give the lehana when gurustanya shishu poshana, very difficult to digest. The child is not digesting even the breast milk, then you should not give the lehana. Then if there is optimum quality of breast milk, no need to give the lehana. Optimal quality, basic quality is there. Now this another parameter, second parameter related to mother. These are the two things. If the mother is having difficult labor, if the mother is having ashukari roga, very infectious diseases, then how will be the nutrition of the baby? Tell me. Then we have to give the food supplement in the form of lehana, medicine supplement in the form of lehana. Because the mother cannot give the enough milk, then this lehana should not be given when there is optimum intake of rasa by the mother. So no need to give you that particular lehana. Then related to the child, for example, Vataj and Pittaj Roga, Vyadhi. Whenever there is a weight loss, growth is not proper, milestones are delayed, some heating symptoms are there, burning is there, inflammation is there, redness is there. Vata and Pitta, if they are on the higher side, Rukshata, Vata is a dryness, that will create dryness, and this will create the heat. So how the nourishment will take place? Then we have to give the lehana, which will pacify the dosha, dhatu and mala. Okay? Without involvement of kapha. If kapha is more, no need to give lehan. Why to give? Because lehan is always nourishing. Don't forget that. This is good food supplement. So whenever necessary, we have to give. Okay? Then dissatisfaction of feeding. The child is not happy. He is not getting, baby is not getting the enough milk and good quality of milk. Then you can supplement with lehana. Excessive crying. That indicates the nourishment of the physical body and mind is not good. then you can give the Lehana. That is it. These are the indications. Nidra Nash. The child is not sleeping properly. Irritation is there. Give Lehana. Then Mutra and Purisha Kshaya. Deficiency. Again, Kshaya is there. Like urine is not passing properly. Urinary tract infection is there. Oliguria is there. Constipation is there. Give the Lehana. Then I think I forgot to mark this particular point. I'm sorry, my dear friends. Here you can concentrate now. This particular discussion is going on. Then Sama Agni Bala. If the Agni digestion is good, then you can give the Lehana. Kshaya, tuberculosis, weight loss, milestones are delayed, give the supplement, Lehana. Vibandha, constipation for minimum 3 days, give the Lehana. But when the child is suffering from these things, can you see? No Lehana, contraindication, no. When there is Agnimandya, his appetite, gas is there in the abdomen, the child is crying always, and you touch the abdomen, he or she will cry more, baby will cry more, indicating there is a Agnimandya. Digestion is not good, then how he can or she can digest the Lehana? So don't give. Atinidra, it indicates the Kapha dominance. When already Kapha is more, no need to give the Lehana. Simple things, simple logic. Ati Mutra and Ati Purisha Pravrutti, don't give Lehana. That indicates Kleda is more. And when Kleda is more, moisture is more, don't give Lehana. Okay. Now, about the diseases. For any disease or other, Lehana is given for the prevention of disease. But if these Santarpanajanya Vyadhi are there, try to understand. Santarpana, Ajirna, indigestion. Then Urdhvajatrugata Vikar, ENT problems, ophthalmic problems, head problem. Samata is there. Sama Vata Dosha, Sama Pitta, Sama Kapha, Sama Dhatu, Sama Mala. Don't give the Lehana or nourishment. Jwara is there. Rasa Pradoshaja Vyadhi. Atisar, indicating some Ama, Kamala, jaundice. Shoth, edema. Pandu, anemia. Hridroga, cardiac problems. Shwas, breathlessness. Kas, cough. Gudaroga, rectal problems. Basti roga, urinary bladder problems. Udara roga, like hepatitis or cirrhosis. Anah, bulging of the abdomen. Visarpa, like erysipelas or cellulitis. Chardi, vomiting. Aruchi, anorexia. Graha roga, graha is a infectious diseases, and alasaka. In these conditions, you cannot give the Lehana. Then Lehana also should not give each and every day 24/7/365. No, it is not necessary. Then Bhojana Ante, after the food, don't give. It should be given Rasayanakal on an empty stomach. Asatmi, if there is some allergic condition to any of the ingredients in the Lehana, don't give. Atimatra, don't be an overdose of that supplement. Lehana is always given as a supplement, like a tonic. Okay, let us see the different drugs used in the Lehana. So these are the different herbs and metals. Herbs and metals for the Lehana karma. Anyone, it can be Brahmi, most important, Manduka Parani, Trifala, Hirda, Bheda, Avalkati, Chitraka, Agnivardhaka. Vacha, stimulant to the brain, nervous tissue. Vacha is always stimulating the nervous system. Saudhnya Prabodhana. Can you hear this word? Saudhnya Prabodhana. Your consciousness is stimulated by Vacha. Nerve impulses are generated. So this is the best stimulant in Ayurveda. Saudhnya Prabodhana. Write down this word. Vacha, Saudhnya Prabodhana. Then Shatapushpa, best digestive, relieving the gas from the abdomen. Shatavari, asparagus, racemosus. Best medicine, Vata Pitta Nashak. Vata Pitta Nashak. Best tonic for the Vata Pitta problem. Best tonic as an immunomodulator. Your immunity, Vyadhi Pratikara Kshamata is increased. Shatavari can increase the breast milk. Shatavari is the best antacid in Ayurveda. Shatavari plant is best medicine to improve the muscular tone, muscular nourishment. Shatavari has a natural calcium. So it is best medicine to stimulate the bony growth, and you can increase the height of the child. Height of the child will be increased. Weight of the child will be increased. And also immunity will be increased because it is also acting on Shukra Dhatu. Don't consider Shukra means immediate semen. Shukra sex. No, my dear friends, no. Shukra is such a dhatu in Ayurveda which is responsible for regeneration of each and every cell of the body. It is not only in the testes. It is not only in the concern with the intercourse, erectile dysfunction. No. Shukra is related with each and every cell of the body for the two purposes. One, regeneration. Second, growth. And third, immunity. So these points about Shukra, you must not forget. Danti is like a laxative. Nagabala, strengthening. Trivrit, Nishottara, again the laxative. These all or one or two or three, anything that you get from the your nearby, what you can say, the medical store, you can mix it with the madhu, honey, shahad or घृत. घृत और शहद के साथ ही मिलाया जाता है, and this Brahmi and Mandukparni basically best brain tonic. They will improve Dhi, Dhriti, Smruti. Please write down. Dhi, D-H-I. Dhriti, D-H-R-U-T-I. Dhriti. And Smruti. Dhi, what is Dhi? Decision capacity. What is correct? What is wrong? Who is deciding? Dhi is deciding. Dhruti, courage. Courage to follow my intellect. Dhruti is a problematic in the alcoholic addiction, in the drug addiction, in the smoking addiction. They understand. These addicted people always, when they are out of their addiction, they understand, I am bad. I should not take alcohol. I should not smoke. I should not eat the nicotine, tambaku. They understand, but they don't have the courage to implement in their life. So these plants are definitely acting on the neurons, nerve tissue, nerve cells, and the enzymatic actions at the neurons, it is get stimulated. Okay. Enhancing the intellect, the reference is Kashyapa Samhita Sutrasthan, chapter number 18. Most of the references are from Kashyapa Samhita Sutrasthan, chapter 18. Write down this reference. Next, Ghrita, prepared with. What does it mean? When any Ghrita is processed, sanskarit, that is called as a medicated ghee. You are correct. What does it call it as a medicated ghee? So that ghee is prepared from Kushtha, which is also acting on the brain. Then Vatankur for the regeneration purpose, Gauri, Pippali for the lung tonic, Triphala, overall all the body tonic, anti-aging, Vacha, stimulant, Saudhnya Prabodhana, and Saindhava, Lavana. That is for the catalytic effect, fast action, and Stroto Bhedana. Medicines will go into the micro channels when we are using Saindhava to enter into the micro channels. So this will also improve the intelligence. Kashyap Sutrasthan. Then Abhaya Ghrita. Abhaya is a Hirda. Abhaya is a Hirda. Ghrita prepared from the Brahmi, Then Siddharthaka, Kushta, Saindhava, Lavana, Sariva. Sariva is a blood purifier. Blood purifier. Then Vacha, Saudhya Prabodhana, and Pippali, lung tonic. It is also Medhavardhaka, brain tonic, and Graha Apakara. What is Graha Apakara, sir? That is trying to protect you from any communicable diseases, infectious diseases. That is the specialty. You can be prevented from the tuberculosis. You can be prevented from measles. You can be prevented from the whatever the list is with us. For diphtheria, rubella, mumps, measles, chickenpox, all these are the infectious or communicable diseases which can be prevented by using this Abhaya Ghrita. Okay. Next is can you see the different Ghritas? Different Ghrita. Ghrita itself is a catalyst. Yogavahi. शहद और घी जो होता है ना वो योगवाही कार्य करता है. उसका मतलब क्या होता है योगवाही? These are carrying the properties of the original dravyas in which it is mixed or it is processed. So, Samvardhana is a growth. Samvardhana Ghrita. It should be taken with mixing with the honey. This particular medicated ghee will improve the physical growth, that is the milestones, mental growth of the children. The child will grow without affliction of any disease and crawl and walk faster. Milestones are more at the proper time. Then Kalyanaka Ghrita. You have to write down all these Ghritas in the examination. Kalyanaka Ghrita, that is also Medhavardhaka and Ayushya, longevity, long life. Mangalya, very holy. Spiritual aspect is also there. Mangalya is a spiritual aspect. Balya, physical strength, mental strength. Graha, ahapaka. That means Graha is an infectious bacteria, viruses, fungi, microorganisms that will be prevented. It cures the apasmara, epileptic fits, apasmara, jvara, fever, kas, cough, vata, rakta. Can be compared with two diseases, gout, number 1, GOUT, and rheumatoid arthritis, RA. Pratishaya, running from the nose, chardi, vomiting, arsha, piles or hemorrhoids, mutra krichra, that is dysuria, painful micturition because of the urinary tract infection. Visarpa, skin diseases like erysipelas or cellulitis. Kandu, itching. Pandu, anemic condition. Hemoglobin normal 12 to 14 gram %. If it is below 10, start Kalyanaka Ghrita. Unmada, hysterical attacks. Visha, any toxins inside or outside. Then Meha, Prameha, urinary problems, and Graha Roga, that is infectious diseases. Next is a Panchagavya Ghrita. Panchagavya. Go Ghrita is cooked along with Go Shakrita, cow dung, Go Shakrita Swarasa, juice. Go Dadhi, curd. Go Dugdha, milk. And Go Mutra, that is cow's urine. Okay, so this Panchagavya Ghrita is prepared with these all substances, and this is curing apasmara, epileptic fits, kamala, that is jaundice, jvara, fever. And this Panchagavya Ghrita is having the reference from, not from Kashyap, it is from Charak Chikitsastan. So these two things, Kalyanaka Ghrita and Panchagavya Ghrita, write down. I will wait. Once again, come on. Kalyanaka Ghrita, Panchagavya Ghrita, Charak Chikitsastan, chapter 9 and chapter 10. Kalyanaka Ghrita, Charak, cursor, see the cursor. Kalyanaka Ghrita, Charak Chikitsastan, chapter 9. Panchagavya Ghrita, Charak Chikitsastan, chapter 10. Please write down. Then this is Medha Vardhaka Dravya. Now we will go ahead. Brahmi Ghrita. We are talking about Lehan, licking. Brahmi Ghrita. This is again Charak Chikitsastan, chapter 10. Purana Ghrita, minimum 1 year old Ghrita, ghee, is cooked with Brahmi Svarasa, that is 4 parts, and Vacha, Vekhanda, Acorus Calamus, Saudhnya Prabodhana, nerve tonic or nervine tonic, Kushta, Shankha Pushpi, Kalka. Kalka is like a pest, 1/4 part. It, Brahmi Ghrita, is very useful as a brain tonic. Unmada, mental hysteria, fits. Apasmara, the apasmara is at the physical level. Unmada is always psychological level. Psychological mental stress is there, anger is there, jealousy is there, and so many hidden emotions are there. Okay. Then papa, unholy things, unrightful things, and alakshmi. That person, when his intellect will start working properly, automatically he will try to behave very nicely. He will try to find out the job, either service or the business ethically, and automatically he will acquire the money. So this is the indirect reference. Somebody, always the students ask me, sir, how that medicines can make him rich? How the medicines can make him rich? They don't understand the principle behind that comment. The principle is that the person who is taking such type of medicine, hopefully or most commonly with the yoga, pranayama, meditation, he will try to think properly, gradually. It's not a one-day job. It's a job of months together. That there is always Ashwasana Chikitsa, counseling is there, psychological counseling is there. There in the society, there are psychologists, there are psychiatrists as per need. The person has to go with them, and they have the many sittings. And after medicines plus counseling, both effect will improve his decision capacity, his memory, his implementation capacity, Di Dhruti Smriti, and Prajnaparad will be controlled. He will not do any Prajnaparad, intelligence, wrong things, and then he will find his life in a better way. So he can go for services, he can go for business, and then he will start good relationship with the society people, and definitely he will out of from the poverty. Are you understanding? Okay. Then Medha Vardhaka Dravya is there. Next important topic for your examination, coming examination. In all this discussion, the most famous, most wanted topic is Suvarnaprashan. This is the most wanted topic. Write down. I will wait. Suvarnaprashan sanskar. Very popular nowadays. Everywhere in Ayurvedic Vaidya, Ayurvedic clinics, you will see the board. Yethe Suvarnaprashan sanskar kela jato. We do the Suvarnaprashan sanskar. Of course, I am going to make a separate video on the Suvarnaprashan, but for this topic of Prashan and Lehana, I am discussing a little about Suvarnaprashan mentioned by Kashyap. So Kashyap Sutrasthan, chapter 18, Suvarnaprashana Sanskar. Can you see? I'm sorry, there is some little printing mistakes are there. So kindly excuse me for this printing mistake. These Sanskrit lines are distorted. Marathi lines are distorted. So kindly excuse me. But we will concentrate on the proper translation. What does it Suvarnaprashan? When we take these drops or the Lehana, Chatana, while facing the east direction, Purva Bhimukh, east direction, a stone should be washed by rubbing it for mortal and pestle, khalbatta in Marathi, khalbatta. By rubbing it with little quantity of water, gold is mixed with together with honey and ghee. Gold ko milaya jata hai. Why this is Suvarnaprashan means you are taking gold. So you can become the golden man. Not by wearing the golden ornaments, but by taking the gold inside the abdomen orally, so that it will boost your energy, because Suvarna is very, very good for the human body in a purified form for all the dhatus. It will make dosha, dhatu and mala samyavastha, equilibrium, balanced, homeostasis. This gold is nourishing, best food supplement.
It is not only working at a physical level, but it also working at psychological level. So the person will be, the child will be fit physically and mentally. So gold is mixed together with honey and ghee, and it should be given to the newborn child for Lehana is mentioned in Ayurvedic text immediately after birth. This is Suvarnaprashan, which promotes the Medha, intellect, Agni, metabolic process, digestive fire, and that's why they will improve the Bala. Bala means strength, Bala means immunity. It provides the following factors. Suvarnaprashan, what are the benefits? You have to write down all these benefits in the examination. First, Ayusham, Ayush, prolonged life, quality of life, Mangalam, everything will be best, auspicious. Punya, virtue or purity, mind purity is more expected in the Punya. Then Vrishya, Vrishya is a virility, great energy of each cell. That is because of the Shukra Dhatu. Then Varani, Varanya, Varna, Varna, good color and complexion, the beauty of the skin. Graha Apaha, keeping away the evil spirits. That means the microorganisms, bacteria, viruses, fungi. After 1 month, what are the effects? If the child is given complete whole month, this Suvarna Prashana, the child becomes Parama Medhavi. Parama, highest rank, the most intelligent child, Parama Medhavi, highly intelligent, and diseases will not afflict the child. Huh? Swasthasya swastharakshanam aturasya vyadhi parimokshaha. These are the aims and objects of Ayurveda. This will be seen by Suvarna Prashana. And after 6 months of intake of Suvarna Prashana, the child becomes Shruta Dhara. Shruta Dhara. That means the child can hold, child can remember everything which he is hearing, immediately going here, hard disk, and memorized, preserved. Data is always stored in the cloud, in the cloud. So that is the effect of Suvarna Prashana. Okay. Now, this is the discussion of Matra of the Suvarna, Madhu, and Ghrita. How much gold should be taken? How much honey should be taken? How much ghee? Matra is a dose, Pramana in Ayurveda. Suvarna Matra in Rasashastra, the general therapeutic dose of Suvarna Bhasma is, forget about Ratti. Ratti is an old measurement. Now you can write 15.6 to 31.2 milligrams. That is explained in Rasa Shastra. That is Rasa Tarangini is a name of the book, Rasa Tarangini. However, the dose in the children is definitely small. It is not like this and should therefore be appropriately considered. According to the Sushruta, Madhu and Ghrita is mixed with Brahmi Swarasa and Suvarna Bhasma, which should be given to the newborn child. The quantity of Suvarna Bhasma is 62.5 milligrams. The reference is Sushrut Sharirasthan, chapter 10. Next is Kashyap, which is a Pitamah, head of the Ayurvedic pediatrics. The newborn child, the drugs, these medicines should be prescribed in the quantity equal to the fruit of Vidanga. Very interesting. He has given the measurement only this much. You must go into the market, go to the medical shop and check how much is the Vidanga or the Vauding. That much only small amount should be given of Suvarna, Madhu and Ghrita. In the growing child, the dose should be increased month by month. But in no case, Kashyap is saying the wise physician should increase this dose more than the quantity of Amalaka fruit. Big. Avla. Go to the market in December month, you can see this Avla fruit in the market. They're very big. The dose should not be such big, only Vidanga. So these are very interesting terms used by the Kashyapa. Next. Madhu and Ghrita Matra. In Bhaishajya Kalpana, if churna is mixed with prakshepa dravya for lehana, the dose of madhu and ghrita should be double as the quantity of churna. So there is a comparison. For example, you take the 500 milligram of churna, then you have to take this madhu and ghrita 1 gram together. Okay. So this is explained in the different text. For example, however, madhu and ghrita equal quantity is considered as a viruddha, very complicated type of the question. Always we say in the adult, when we are giving any medicines mixing with the honey and ghee, we are not using honey and ghee in exactly equal amount. According to the prakriti or according to the disease, sometimes we take little honey more and less grita. Sometimes we'll take more grita and less honey, but never in the equal quantity. But exception is there. Please write down exception. EXCEPTION. Exception is there. And what is that exception? Jat karma sanskar. Write down. Jat karma sanskar. The newborn child, which immediately after the cutting of umbilical cord, madhu and ghrita is satana, lehana, is administered in equal quantity, even though it is considered as a matra viruddha or visha. Why? Why it is done? Vayu gets aggravated. We want the first stimulus. That's why nervous tissue stimulant we want. That's why it is like a shock, giving in the equal quantity. Vayu gets aggravated and helps to boost the immune system. So this is a exception where we can give the madhu and ghrita in equal quantity, but still, as per my own practice, as per my own guidance to the different students, I always say, although it is true, but better way, madhu and ghrita should be having a little bit difference in the matra. Acharya Charak is giving madhu, ghrita and Suvarna Basma as a Suvarnaprashan sanskar, but Sushrut suggesting madhu, ghrita, Suvarna is there, but addition is a Brahmi swaras. Charak has not given in Suvarnaprashan the reference of Brahmi swarasa, but Sushrut has given the reference of these Brahmi swarasa with madhu, ghrita and Suvarna Basma. So my dear friends, this is all about the prashana and lehana, what you can say, the vidhi or the sanskar, which is the important topic for your examination. Basically, you must prepare with these different types of formulation. Here you can see the Samvardhana Grita, then Kalyanaka Grita, then Panchagavya Grita and Brahmi Grita. And never forget the indications and contraindications for Lehana. What is Prashana and Lehana are the synonyms. So after completing this, let me allow to give you some audio revision types of clips for some particular diseases. For example, in infectious diseases, there is one disease which is called as a rubella. So please open your notebooks and take the notes of rubella. Okay. What is rubella? Rubella is like a red. Write down. Rubella is a red color. So Latin word is a red. Rubella is also called as a German measles. Write down. German measles or 3 days measles. 3 days measles, and this rubella is caused by rubella virus. Rubella virus. This infection, there is a rash on the skin. Please write down rash on the skin. Okay. Now, how this is coming? By the droplet infection. Some other child or the another person is having cough and cold, and by droplet infection, it is spreading. Next important is the incubation period. Rubella, we are talking rubella, 2 weeks incubation period is there. Then the disease duration, 3 days, it is affecting to the child. What are the symptoms? First important for the rubella, rash. Then lymph nodes, here axillary, cervical lymph nodes will increase.
fever is there, sore throat is there, and tiredness will be there. Now, what we can do? There are different tests. One can do even the blood culture. One can do the blood culture, or another thing, you can do the antibody test. Especially antibody test is done maximum times. What can be the complication? There is a testicular swelling. Testicles will be affected, and inflammation of the nerves. Inflammation of the nerves. Okay. So, my dear friends, there is a treatment, no specific antiviral treatment is available. So, you have to give the symptomatic treatment like antipyretics. That means which will reduce the fever, like for example, crocin, or in Ayurveda, Mahasudarshana Kada. Plenty of fluids, lot of fluids should be given. And MMR, this is a particular vaccine, mumps, measles, and rubella. Write down MMR vaccine, MMR vaccine, that is mumps, measles, and rubella. Okay. Now, my dear friends, still there is some time, and I would like to discuss something about muscular dystrophy. So, you are expected to write down the name first. Please write down muscular dystrophy. I will like to discuss with you muscular dystrophy, because this is not the infectious. Please write down, this is not infectious, rather this is a genetic type of the disorder. Please write down genetic problem. There is a tissue wasting, proper muscle growth, nourishment is not there, it is wasting, less. Mausakshaya. Write down Mausakshaya. Okay. So this is a degenerative degeneration. Two terms are there. Regeneration is a nutrition, and degeneration. So this is a degeneration disorder because of the inadequate nutrition. Nutrition is not proper. Okay. So muscular dystrophy, there is a muscle weakness. Write down important symptom: muscle weakness and wasting. Muscle weakness or wasting. Another cause, as I have mentioned, apart from nutrition, it may be inherited disorders from the parents. Genes problem is there. It is a genetic disorder, and which will give gradual weakness of the body muscles. Gradual weakness is there. Okay. How it is diagnosed? Write down clinical diagnosis. Clinical diagnosis. The child is diagnosed inability. The child cannot walk. Walking will be problem. Sitting will be problem. And very advanced stages, there will be breathing problem, moving the limbs problem, and gradually lot of weakness is seen. There are different types of the muscular dystrophy. You write down the types. First is MDD. I will give the short form right now. MDD. 3 words you remember: DMD, DMD. Always MD is a muscular dystrophy. Then BMD. I repeat 3 names: MDD. Write down MDD, DMD, and BMD. And then write down in short, what is that? MDD, myotonic muscular dystrophy. Myotonic. Myo means muscle. There is a problem of tone of the muscle. Then Duchenne muscular dystrophy is the name of the scientist. Duchenne's muscular dystrophy. And third, Baker muscular dystrophy. So 2 names are with the scientist name. Okay. Now we will try to see the important symptoms. First is the MDD, that is myotonia. There will be stiffness of the muscle, very hard, stiffness of muscle. Okay. This stiffness will increase in the cold temperature. In the cold temperature. Next is a DMD. DMD, this problem is more common form of muscular dystrophy, very common. Duchenne's muscular dystrophy. It is usually seen from the age of 2 to 6 years. 2 to 6 years, muscle size will be decreased. This bicep, tricep, deltoid muscle, then thigh muscle, they will be reduced. Kshaya, Mansa Kshaya. And grow weaker. Strength will be also reduced. Nutrition reduce. Tone reduce. Weakness will increase. Then arms, legs, and spine become deformity will be takes place. Deformity. Next is a BMD. This form is very similar to the above DMD, and many symptoms are very similar. It can be in between 2 to 16 years of age, or even till the 25 years of age, this particular muscular dystrophy BMD can take place. Now, general symptoms, there will be difficulty in climbing upstairs. Climbing upstairs is a problem. Then unable to jump. Unable to jumping is not problem. Leg pain will be there. Leg pain. Facial weakness will be there. Inability to close the eye. If you try to ask the child to close the eye, he will not be able to close the eye. Okay. And shoulder and arm weakness is there. Okay. Then which are the tests? Blood test, genetic blood test can be done with the muscle biopsy. Write down muscle biopsy. Small piece is taken by the needle and examined. And EMG, electromyogram. Electromyo. Like you know the ECG, you know, heart. EEG, you know. But this is EMG. Electrical signal and that is myogram. Myo is a muscle. Then there is not specific treatment is available. Okay. Then overall health is maintained of the child. Then physical therapy, especially physiotherapy is there. Then proper nutrition. Then prevent the deformity. Like Ayurveda, Snehana and Svedana and Basti are the best treatment for muscular dystrophy. Please see my video on the muscular dystrophy. Bruhat Vata Chintamani type of the medicines, definitely we can use. Nutritional counseling, proper nutrition, protein, carbohydrate, fats, vitamins, minerals, and the psychological counseling also can be done. I think this also we have covered a little bit about rubella and muscular dystrophy. I have talked, and then I would like to talk little bit about ADHD. Please write down. This is psychological problem, my dear friends. ADHD. Please write down ADHD. This is the another that can be expected, but video is there, my dear friends. Don't worry, and you will be happy to see that video, because we have a lot of patients of this type of complaint. So please write down the full form: attention deficit and hyperactive disorders. Okay. This is the chronic condition. First of all, it is a chronic condition, and it is causes are different. For example, pregnant mother, if she is consuming the alcohol, pregnancy, during the pregnancy, mother eating the tobacco or the smoking, then the child can get hyperactive children. Then premature birth. This is another cause, premature birth, and pregnancy infections. During the pregnancy, the mother gets some serious infection by which it is affecting the child. What are the symptoms? The child will be restless, always restless, and proper attention is not there. He talks continuously. In Ayurveda, it is a Vata problem. I always remember. So Snehana, Svedana, Basti is the best treatment. This is typical Vata problem. Rajo Gunadhikya. Sattva Rajatama. So Raja is more, so overactive. Pralapa. Pralapa is a Vata. Excessive talking, irrelevant talking, and disturbing the people. Disturbing the society. Cannot concentrate at one place with the one thing and always mind is diverted. Unattentive, not properly attending. Child can get bored after few minutes in any joy. He may be playing with one game on his mobile. He is immediately leave that game and go for outdoor playing. After outdoor, he immediately come to the house. Oh, I am bored. So this boring is always there. Then always forgetting many things and always moving here and there. So treatment is basically, in spite of the medicine, behavioral therapy. Counseling is very important, repeated counseling. Then there is a yoga role is there, pranayama, deep breathing exercises, meditation is there. So this will definitely help. Then education to the parents for physical exercise and meditation. Then brain stimulant or brain tranquil type of the medicines, Shirodhara is the best treatment for hyperactive children. Basti, Yapana Basti is the best treatment for hyperactive children. Then some examples, some modern doctors, they give the dopamine type of the medicines, okay, to get the proper attentive type of the action of the neurons. So my dear friends, this also I have covered. And lastly, I may try to give you some examples or some description of Bal Shosha. Please write down in your notebook, Bal Shosha. We are discussing some of the diseases which are for the terminal examination, my dear friends. So you write down Bal Shosha. Okay. So this is a Kuposhana Janya Vyadhi. So I have taken the different diseases. This is Kuposhana Janya. Ayurvedic typical terminology is there. It is explained in Ashtanga Hridaya Uttar Tantra. Write down the reference. Ashtanga Hridaya Uttar Tantra, Bala Shosha Vyadhi is there. Okay. The cause of Bala Shosha is the Shleshmika Anna Sevana. Shleshmika. Shleshmika Anna Sevana. And Shitambupan, that is cold substances always, and Divaswap, excessive sleeping in the daytime. Okay. So Bala Shosha, the name is something confusing. Okay. Here the Nidana is Atinidra, causes are there. Atinidra, Ati Shitala, and Shleshmala Stanyapana, when the mother is having more Kapha Dushita Stanya. So Samprapti, Nidana Sevana, Kapha Dosha Vikruti. This Bala Shosha is basically Kapha Dosha Vikruti. Vitiated Kapha is damaging to the Rasava Srotas, and there is a Stroto Avarodh. Sroto Avarodh. And because of the Sroto Avarodh, there will be Aruchi. The patient will not having the proper appetite. Pratishaya. Kapha problems are there. And then there will be Bala Shosha because of Srutorodha. So Lakshanas are Aruchi, that is anorexia, Pratishaya, that is cold, Jvara is a fever, and Kasa is a kapha. And fast afterwards, this is maybe something like a Santarpana Janya Vyadhi, but ultimately it turned to the Shosha, that is emaciation, and Shvetavarna, that is whitish discoloration. So there is a Shishu Shosha. Nashaka Shodhana Ghrita is given to relieve the Srotorodha. Obstruction is relieved by specific medicated ghee. And it is having Shaliparni, Vacha. Vacha is a Saudhnya Prabodhan, and Srotorodha Nivarana is there. Pippali is there. Tagar is there. And Punarnava is also there. So this is mixed with the Grita. Ghee is given as a Chartana. And Suvarna and Madhu, that is Suvarna Sanskar, is also useful for Bala Shosha Vyadhi. So my dear friend, this is all for today's Kaumarbhrityatantra lecture. We will continue our lecture series on the Sunday in the morning at 11:15. Swasthavritta lecture is there. And in the afternoon, 3 to 4, Charaka Uttarardha, we have started Chikitsastan. We will continue that discussion. Thank you very much for your nice cooperation. Take care. I wish you all the best for your terminal examination and see you soon. Thank you.